I think it's really been great to focus on this particular issue of maternal health, maternal and child health. And in July, I think on July 13th and 14th, we held the very first dialogue that was convened in this very hotel. And that discussed maternal health challenges in Kenya, and did come up with a number of issues. So over the next 2 days, we will be looking at how we can use the maternal health framework to undertake action to improve health systems in Kenya. For many people, when you hear health systems, we tend to tune off for many different reasons. But as you know, globally, there's been a lot of concern and continuing concern indeed about the lack of progress towards the MDGs 4 and 5 on maternal health and child health. There's been a lot of global initiatives that's been set up. We have the Partnership for Maternal, Newborn and Child Health. We have Countdown to 2015. We have the Maternal Health Task Force. The UN Secretary General's Commission on Women's and Children's Health, they just released its report and recommendations. And all of these global movements are coming up just in recognition of the fact that we only have 4 years to go to 2015, and where we are supposed to have met certain indicators that we've agreed to way back in 2000 on the MDGs. And many countries in Africa have made little or no progress. And in some, indeed, the indicators have worsened over the years. The central question around all these global discourse and movements is really the fact, why do women and children still die from causes and conditions that can easily be prevented by what we know and by available technologies? When you think about diarrhea, killing thousands of children, when you think of maternal deaths, with current estimates that 530,000 women will die as a result from pregnancy-related causes. And yet, we know some of the most cost-effective interventions that could save these lives. Why do they still die? With respect to maternal health, we've had the 3 delays that have been, over the last 20, 30 years, discussed at various forums. The delays in deciding to seek appropriate care, in actually getting to the health facility once you decided to seek care, and in getting appropriate care once you reach the health facility. If you look, so each of these 3 delays are actually things that relate to health system challenges that concern us today. If you look at the 3 strategies in the Commission on Women's and Children's Health, the Secretary General's Commission, they are all related to the 3 delays. The first is really to reduce financial barriers. And this is one of the key factors that affect decision making, whether to seek care or not. If you look at your pocket and you look at the cost of care or transport to the care to the health facility and all that, many women may decide or choose to stay home and have the baby just because of the financial constraints involved. In the UN Secretary General's Commission on Women's and Children's Health, the second key strategy is to really create strong policy environment towards women and children's health. This is something that can respond to some of the constraints which might be systemic in nature that affect access to health facilities, whether they relate to the availability of the health facilities themselves, or of the mode of transport to get to those health facilities, or other systemic issues that can limit access, even when the health facility might be even when the resources, financial resources and barriers are removed. Their third key strategy is to strengthen and improve the delivery of health services. And this will relate to whether women are able to receive adequate care once they get to the health facility. And as you look at these global strategies and conditions and recommendations, I think that for us in Kenya, the key question really is, what do we need to do in terms of strengthening the health system that can deliver appropriate care to women and children. For these whole sets of strategies to come together, I think there is the need for us to, one of the key factors that's been underscored in all these partnerships and global movements is the fact that countries need to take leadership and ownership, both of the problem and of the solutions. And I believe that the meeting we are having here today is central to enabling Kenya as a country to take leadership and ownership of the maternal health challenge in this country. So what would that leadership and ownership look like? I think this is one of the reasons for this particular meeting today. Is the question, how do we take responsibility as Kenyans to create a health system that is both responsive and that meets the needs of women and children's health in Kenya? I have three key areas I think I would want us to consider and reflect on over the next day and a half. One is the first recommendation of the Commission, of the UN Secretary General's Commission on Women's and Children's Health, which is really around registration of vital events, births, deaths, causes of death. And the recommendation is that by 2015, every country will make significant improvement in establishing systems that can ensure the effective and comprehensive registration of vital events, setting up a vital registration system. You know, one of the myths we have in Africa is that what you don't know does not hurt you. But you know, if you have a cup of cyanide here and you don't know it is cyanide and you drink it, I can guarantee you'll be there in minutes. What we don't know can hurt us and will hurt us indeed. And if you look at the situation in Kenya, supposing we actually have an accurate account of how many stillbirths occur in our health facilities, of how many women walk to the health facility to have their baby and come out as corpses. I was told about a week ago that in some of our health facilities and maternity wards, there's actually new incinerators being built to discard stillbirths. In instances where there have been maternal audits, where people have been held accountable for every single maternal death, I think without much investment, new additional resources being put into the system, we've seen huge and significant improvements in maternal health outcomes. Whether you look at Mexico, you look at Cuba, and many other places, even in poor countries that have instituted systems that will hold people accountable throughout the system for every single maternal death, we will see changes. So can we actually put in place a mechanism that can allow us to have accurate reporting of how many children are dying and how many mothers are losing their lives in pregnancy? I think the second thing we need to think about is the issue of accountability. And when I think about accountability, I think accountability at all levels. For every stillbirth, neonatal deaths and maternal deaths, especially at the health facility, in every instance where this has been done, as I said before, there has been tremendous progress. So how do we strengthen the systems of accountability at various levels? For us as researchers, for us as program managers, policymakers, wherever we are, whatever our role is in this system, how do we create systems that can hold us accountable to each other and to the women and children we want to serve? The third area I really would want us to consider and think about as we go through how we can improve health systems through a maternal health framework is to look at the issue of whether indeed we have one particular system that can serve the entire country. Does one size fit all? Or do we need to have context-specific strategies for responding to the maternal health challenges? Let me give you an instance. Supposing you live in Korogocho or Kibera, and we've shown that while maternal mortality ratio in Kenya is about 488, in a place like Korogocho and Viwandani, in the slums in Nairobi here, it's over 700. How do we deliver services? And what type of systems do we need to put in place here? We've tried a number of systems like output-based approach to service delivery, where you actually compensate people for performance based on performance. And we've known that women can buy these vouchers and still deliver at home because you're in labor at 2 o'clock in the morning and there is nowhere to go, or because health facilities are outside, or because there are security concerns. What type of systems do we need to put in place in this place to be able to support women to receive care when they need it? One of the remote places, we talk about maybe Moyale or Marsabit or Garissa. Can that system work in that place? What type of system would we need in settings like that? Is it inconceivable to think about the possibility that we can have many four-wheel drives there and helicopters and communication systems that can allow people reach maybe the district hospital or something like that to be able to bring the needed health care to these people when they are needed? So as we look at how we can support systems, we need to really look at where we are as a country at various levels and see what do we need to do in these places to respond to the challenges of maternal health. One challenge for you as you go into the working groups will be, what should improving health systems through a maternal health framework look like in Kenya? Should we invest in strengthening maternal, newborn, and child health programs as a means to strengthening the health system? Or should we actually invest in strengthening the health system in general that will ultimately then deliver quality and better maternal and child health outcomes for people in Kenya? Put differently, do we need to train midwives and put them in every single health facility? Or do we need to train a cadre of health professionals, whether they are nurses, clinical officers, midwives, and others, that can work as a team to deliver care and services where they are? I think this is where national leadership and ownership begins. And I believe and hope that through these 2 days of discussions in our various work groups, that we can come up with practical, implementable solutions that can strengthen health service delivery to meet the needs of women and children.